Colposcopy is required in a tiny minority of patients who present to the cervical screening and who are found to have some changes on the cervix suggested by the cervical screening secondary to a very common virus called the HPV virus. So therefore, part of the cervical screening is the colposcopy, which is the second step in the screening process that is going to be required when the smear suggested some changes on the cervix that happened secondary to the HPV virus that warrant a closer look by referring to the colposcopy clinic. And the reason for referring to the colposcopy is simply because to ensure that the changes suggested by the smear test is either confirmed or excluded by the colposcopy examination. And therefore, it is part of the screening system to ensure that no abnormalities are missed on the cervical cells. And if these abnormalities are diagnosed, then they can kept monitored or treated at the same time if indicated. Thank you. The colposcopy is a complementary test for the cervical screening, and it's often done in the secondary level of care, which is either a particular colposcopy clinic or in a hospital facility. So it becomes necessary to do the colposcopy if the smear test suggesting changes of the cervical cells secondary to HPV virus. And as we know that the cervical screening is a screening test, it's a suggestive test. Therefore, any of these suggestions, they need to be confirmed or excluded by undergoing the colposcopy examination. And the colposcopy is a camera test, like as a pair of binoculars. We apply a couple of solutions on the cervix, and under the direct vision of the camera test, we see if these changes suggested by the smear test become visible on the colposcopy camera test. And if they are visible, then at what level of changes they are, depending on the impression of the colposcopy. And at that time, then biopsy may become indicated, which feels like a gentle pinch on the cervical tissues to undertake a very tiny fraction from the tissues and send them to the lab to ensure that the smear test and the colposcopic impression and the biopsy, they're all forming a straight line or a clinical story to ensure that cancerous cells are not missed. And at the same time, if these changes are of the mild type, then in these scenarios, we could probably just observe. And if they are of the severe type, then we could probably discuss a form of local treatment with the patient as well. The best preparation for the colposcopy is by turning up to the test, as the colposcopy is an important diagnostic test rather than screening test, and therefore the examination is not meant to be particularly painful. It may be perceived as uncomfortable simply because we need to insert a speculum that will help the clinician to visualize the cervix satisfactorily in order to perform the test. So generally speaking, most of the patients, they tolerate the examination quite well. However, in a very tiny fraction, if the smear test, for example, has been on the slightly painful side, then in preparation, it's better maybe to take some painkillers before coming to the colposcopy appointment. Simple painkillers should be okay. Otherwise, does not require particular preparation at all. On the other hand, if there is any clinical doubt that the patient may be pregnant, it's always advisable to inform the referrer, whether the GP or the nurse specialist, as well as the clinician, that I could be pregnant. We categorically do a pregnancy test as well to ensure that pregnancy is checked, the pregnancy status. And if the patient was found to be pregnant, then we can still proceed with having the colposcopy. However, may reserve the biopsy unless it's a very strongly indicated reasons to perform it. Otherwise, we often defer the biopsy until 3 months after delivery. Colposcopy is performed in a dedicated clinic that is staffed by administrative, nursing, and clinical staff. They all work in a multidisciplinary approach to make sure that the test is done to the least disturbance of the patient, and in a dedicated facility as well, equipped with a often very good clinical equipments and clinical kits as well to ensure that the test is done reliably and accurately. What it includes a camera test we call the colposcope, which resembles a pair of binoculars, and we have a closer look at the cervix. And often we share a screen that is connected from the colposcope so that the patient can be engaged and involved in the clinical interpretation of the test, and often found it useful as well to be taught what we are finding so that it can improve their engagement with the care. However, some patients, they may prefer not to be distracted during the test, and that's absolutely fine as well. And after that, we apply solutions on the cervix, and these solutions are not meant to cause pain or discomfort or even damage to the cervix. It's just, we call it tissue enhancement solutions, so that the tissues can be revealed easily on the camera test, and therefore easier to distinguish the level of the abnormality if persistent, and if they are present, to be able to grade the abnormality based on the camera impression. And then after that, maybe a biopsy is indicated, and the biopsy feels like a very gentle pinch, just like pinching to the skin. And it may cause very, very slight bleeding that is very easy to stop and to be controlled. And otherwise, the patients most of the times will be able to resume their daily activity straight away after the examination. However, we generally advise them to avoid, for example, having a sexual intercourse or having a bath or having a tampon, just for 3 days to allow the base of the biopsy to heal quicker and without any risk of infection. Otherwise, the test should be relatively straightforward, and it shouldn't take more than 20 to 25 minutes. Cervical biopsy becomes indicated for several clinical reasons. The vast majority of these reasons fall within the remit of the cervical screening. If the cervical screening is suggestive of some cellular abnormalities of the cervix, and based on the grade of these abnormalities, whether mild or moderate or severe, secondary to the HPV virus, then a biopsy may become indicated after the colposcopy examination. However, there are other reasons that are, we call it, not related to screening. For any clinical suspicion by the consultant or by the GP or by the nurse practitioner visualizing the cervix, then anything that is becoming unusual or doesn't look normal compared to the other tissues of the cervix, then it is always necessary to take a biopsy just to exclude any factors for abnormalities, cancerous abnormalities, or infectious reasons, or even we call it physiological reasons that sometimes develop around the cervix and cause some changes that may look like an abnormality on the cervix, but when we take the biopsy, in fact, nothing is found, is completely normal and healthy cervical tissues. And on the other hand, it is always important to ensure that the biopsy is done secondary to the patient symptoms. So I'll give you an example. If women are troubled with bleeding after sexual intercourse, for example, or bleeding in between periods, it's often necessary to have a comprehensive review of the entire genital tract, starting from the vulva, from the vagina, and from the cervix. Then we go the way to the uterus and the ovaries and the tubes. And the cervical biopsy in this scenario becomes important if the clinical examination warrants a biopsy from the cervix if there is any suspicion of suspected abnormality of the tissues on the cervix. There are hardly any side effects actually, because the colposcopy examination is an outpatient diagnostic test. It is often done within the remit of 20 to 25 minutes, as we mentioned. Quite often the patients will be able to resume their daily activities straight away after the appointment. And on rare occasions, it may become a little bit uncomfortable. And however, it's not to the level to become distressingly uncomfortable that the patient's unable to do the test. And in rare occasions that the extreme sensitivity or pain on the cervical tissues, then we often support the patient by doing a local anesthetics on the cervix to make sure that whatever is required, whether it's a biopsy or whether it's a local treatment, it's completely pain-free under the effect of the local anesthetics.